The reason I became familiar with the NLR, that's the neutrophil lymphocyte ratio, the reason I became familiar with this was because I was keeping track of some prostate cancer risk markers. The one I was keeping closest track of was the percent-free PSA and the LMR, the lymphocyte monocyte ratio. There was a publication that had tracked how well patients did with their prostate cancer, and they determined that the markers with the most value was the percent-free and the LMR, and then the NLR, and then the PSA. So the PSA had the lowest value as far as a statistical method. That method is that they call sensitivity and specificity. The percent-free had the highest, the LMR had the next highest, the NLR had the next highest, and the PSA had the lowest. And they also combined the percent-free and the LMR for a combined highest level of sensitivity and specificity. So that's why I was keeping track of, particularly of the LMR. I didn't really realize the NLR had value for the COVID-19. Of course, I had no idea. This was a year and a half ago or so. I didn't even know about the SII until, maybe 9 months ago, when I came across an osteoporosis study showing that with an SII over 934, the SII is the platelets times the neutrophils divided by the lymphocytes. That over 934 indicates a higher risk of osteoporosis. Now, more recently, as I've been investigating these markers more and more and learned more about them, I discovered that these markers are highly relevant for COVID-19, for how severe it's going to get, particularly the NLR. That's the one, after checking all these markers in these different hospitals, they found that one was possibly the most relevant for how severe the disease is going to be. So that's why this knowledge that I've come across, which was mostly just by luck. It's not that I'm a great genius or anything, or that I deserve a Nobel Prize. It was just by luck that I started going through my records and seeing if there was any kind of correlation to the interventions I was doing. And there's a very strong correlation in this N=1 experiment. That's an engineering term, N=1. There's only one subject in the experiment, which is me. So anyway, I don't expect a Nobel Prize, but this could really help a lot of people, because we all have these tests, the CBC blood panel, in our records, in our medical records, so we can go and calculate them. If the let me get the graph up there, and I'll talk take my face off there for a while, and we'll go through. This is about 3 years. This is about 2017. The last test which is way over here, that was in September 2020, and over on this side is around 2017. Now, this point here, that's the SII, and then we have the NLR. That's the one that they've determined has a lot of value for COVID-19. I think if you just look at this quickly, you'll see that the two of them are tracking very close to each other. Now, the NLR is measured in single digits. Like if it's above 2.50, then that's considered a higher risk. My last test I think it was about 2.3. But you can see at different times, my NLR has been way above the danger mark. This was the worst right here. Now, I had to get rid of the digits so I could get the charts to the scale so it would match up. So I just got rid of the digits on this. So I was using 230 instead of 2.3. And so the major intervention was at this point, this was in December 2018. I started taking a large dose of, and it's marked up here. I've got it marked up at the top of Longvida and what else was I taking there? Oh my gosh, my mind's going blank here. Well, anyway, I started taking Longvida and Pycnogenol, 200 milligrams. And I started taking them 1.5 grams instead of 500 milligrams. I started taking 1.5 grams. And you can see how much from December to August, how much these levels dropped. And then I started getting, for a variety of reasons, I started reducing the dosage. And then from August to December, these markers had gone up again. And it was around then I was getting pretty familiar with LMR, and that shook me up a little bit. So I was looking into, I'd come across publications about modified citrus pectin. And 10 days before the next test, I started the modified citrus pectin. So you can see how far it dropped. Even though I only started the intervention 10 days before the test. Well, the test was so successful that I reduced the dosage. And then it went up. And then at this point here, when it had gone up, I increased the dosage again. And so then over the next, from January to September, you can see that the markers are considerably lower than they were years before, 2 or 3 years before. Now, there's a couple other factors at work here. My age, I'm 73, so there's aging factors that are pushing this also. And I've been strictly keto for over 4.5 years. And that keto helps lower inflammation a lot. So I can't say for sure how much this is going to apply to other people. I'm not recommending anybody else do this because I'm not a doctor. Even if I was a doctor, I would have to see you and ask you a lot of questions, become familiar with your personal. But the supplements that I'm using, the Longvida and the Pycnogenol and the modified citrus pectin and Honokiol, they've all been studied pretty thoroughly. They have very mild side effects, if any side effects. But if people want to try these things, by all means, try to find a functional medicine doctor or a certified naturopath who can help guide the use. And if you don't have any experience with using herbs at all, then by all means, and you've decided that you're going to try this anyway, then just try it at a very, very low dose, and make sure there's not a sensitivity or a allergy. So anyway, if people want to go back and review this, they can stop and scroll backwards. And I think adding the SII is pretty new because the NLR has been shown to be associated with COVID-19 severity. And the SII, which you can see here that it tracks pretty closely, and it may even be more sensitive. So anyway, I hope this helps people. And if there's any questions or comments, by all means, make them. Okay, thank you for listening.